Are you or a loved one in crisis? A mental health crisis is when you need urgent help in dealing with a mental health issue. There are different kinds of mental health crises: extreme emotional distress, anxiety, panic attacks, depression, hopelessness, suicidal thoughts, paranoia, or seeing or hearing things that others don't, and other behaviors that seriously impact your life. If you or a loved one are in crisis, it's important to understand your options. The first step in dealing with it is asking for help. But who do you call first? If there is a life-threatening emergency, stop and call 911. If the person in crisis requires immediate medical attention or law enforcement to provide for safety, it's important to get them help straight away. If you do not know where the person is and you are worried for their safety, you need to call 911. Once the person is safe and secure, professionals will assess the patient's mental health. If you want help for a mental health crisis and there is not a life-threatening emergency, call SLO County Mental Health Services at 1-800-838-1381. If you want immediate support for emotional distress, suicidal thoughts, or to find mental health resources, call the SLO hotline at 1-800-783-0607. This is an accredited crisis center and talk line available 24 hours a day, 365 days a year. When it appears that the person in crisis may need psychiatric treatment, each agency you have contacted will then call the county's mental health evaluation team to provide an evaluation. The mental health evaluation team serves the whole county and is available to both law enforcement and hospital emergency rooms for interventions with those who experience serious mental illness. They also respond to health clinics, private doctors' offices, therapist offices, schools, and private residences when there is not a life-threatening emergency. The mental health evaluation team evaluates the individual in crisis to determine the appropriate level of care, psychiatric treatment, or support needed. The mental health evaluator determines if the individual is willing to seek voluntary support, treatment, or other services. If so, the evaluation team will help the individual develop a plan to get well. If the mental health evaluator determines that as a result of a mental disorder, the individual is a danger to themselves or others or is gravely disabled, and the individual is not willing to accept voluntary treatment, the evaluation team will place the individual on a 72-hour hold for treatment at an inpatient psychiatric facility where the patient will receive a higher level of care. Ultimately, the crisis worker is focused on empowering people to become more self-reliant and less dependent on outside resources. For more information, visit slocounty.ca.gov.